What are the early warning signs of rheumatoid arthritis?
Yes, early diagnosis is important, especially nowadays, because we have such a wide range array of treatment options. If it was 50 years ago, really that wouldn't make significant difference,
Mm.
except that it would help with symptoms. But right now, at our current time, we have so many options to treat, and if we start treating early, will prevent damage and joint deformity. That's why early diagnosis is very important nowadays. The early symptoms, classically, as known, but it also comes historically, it's the distal joints, like hand, feet, small joints that
Mhm.
are symmetrically both sides of the body, right and left, affected, and are associated with swelling, morning stiffness. This is the classical presentation, but it's not always the early presentation. So when early rheumatoid arthritis doesn't always present with symmetrical polyarthritis in the hands and feet. And stiffness is a very important thing. Morning stiffness, as we talked about it earlier, if it's prolonged morning stiffness, if patients wake up early with stiffness and they need like more than half an hour, 45 minutes to walk or to, take a warm shower or wash their hands under warm water, they describe it very often like that before they can actually move. So important sign. But also it can present with just one joint being swollen for 6 weeks. That's an early sign too. So patient need to seek attention. It's not a classical presentation, but can present like that. It can cause something called palindromic presentation when in one joint you have symptoms for 6 weeks or even less and then goes away and then 6 months it comes back. That's also can be early sign of rheumatoid arthritis. So again, anytime the joint swelling happens, morning stiffness, and it lasts more than 6 weeks, it's better to seek medical attention to get it checked out.
Okay, so it's not just pain, but then all these confounding factors that come along with it that helps us to determine, okay, maybe,
Yes.
these are the symptoms. Okay. So let's just say I come to your office with all these symptoms, I present myself with these symptoms. How do you diagnose arthritis and what are the different blood tests that go along with it?
It's most important one of the most important questions. The gold standard of diagnosing rheumatoid arthritis is judgment, clinical judgment. When the rheumatologist sees the patient, examine the patient, and um, it determines that the presentation is consistent with rheumatoid arthritis. A lot of things that we're familiar with, their classification criteria, like certain number of swollen joints, certain duration. Those are classification criteria that are used to involve patients in the clinical studies, but they are not. Some people don't meet them, but they still have rheumatoid arthritis. So
Uh-huh.
gold standard is clinical judgment being
Yeah.
evaluated based on clinical symptoms and physical examination findings. Then, as a supportive tests, we can get blood tests. There are
Right.
certain autoantibodies that are detected in up to 80% of patients, such as
Oh.
rheumatoid factor and anti-CCP antibodies, a
Mhm.
cyclic citrulinated peptide. But there are some others. They are developing newer, but those are more commonly tested. And they are present only in 80% of patients. When they are present, it's helpful, but sometimes they are not. So people can have rheumatoid arthritis without having those tests in the blood. Also, we check for inflammation markers. They're oftentimes elevated, but sometimes they can be normal as well. And then we use imaging to confirm the diagnosis or rule it out. X-rays, they are not very helpful in early rheumatoid arthritis because by the time X-ray shows something, it might be already late to start treatment. Uh, to prevent damage, not musculoskeletal ultrasound can be helpful in cases when you're in doubt if there is an inflammation in the tendons and the joint, and rarely MRI also can be helpful as a test to confirm the diagnosis. Yeah, so clinical judgment, clinical presentation, and supportive blood and imaging studies. That's how we diagnose it.